Hi, I wanted to record a quick video to get you ready for the upcoming Inhalation Device Lab. If you go on Canvas and go under Inhalation Devices, Overview and Homework, this will bring you to a page that contains all your content for next week's lab. You'll see the pre-lab instructional video that I'm recording now, the standard overview document, which we'll show in a moment. You'll also see a lab lecture PowerPoint. In the past, this lab was accompanied by a lab discussion, which we had to unfortunately get rid of in order to fit RX files into the sequence. So I will hit some of the high points on that PowerPoint here. I will say that when you pull it up, do not be daunted by the fact that it's got 52 slides. I'm going to cover that in a moment. You will also have your team device assignments here listed on Canvas and your homework questionnaire. I will note at this point, team leaders, you do not need to submit any team responsibilities documentations forms for this week's lab. So first and foremost, we're going to pull up the overview document. So what you need to wear for this week's lab is professional dress, the white coat. You'll also will receive in advance, each team will have one inhaler device that you get to take home with you and experiment with. So you'll also need to bring that device back to lab with you. At the end of this lab, you will each team will turn in a copy of their questionnaire, and we're going to go over the questionnaire in a moment, but I will say that for the day of lab, it will be helpful for each individual student to have access to either a hard copy or an online version of this document, this questionnaire, because each individual student needs to be an expert on that device that you take home. So the goals for this lab: first and foremost, we want you to be able to demonstrate the proper technique associated with using the various different inhalation devices. We will be seeing 8 different drug delivery devices and 1 peak flow meter during this upcoming lab. So you should understand the differences between the various inhalation devices and their techniques, be able to counsel patients on any of the devices that you see. I will go ahead and give you a hint that you can expect to see one of these devices on your OSCE. So objective number 3, you should be able to provide appropriate counseling to a patient on one of these devices. So it's very important that you come to lab ready to learn as much as you can. This is going to be a very hands-on lab. In lab, on the day of lab, I mentioned this briefly, your team of 4 students or 3 students will be divided into the 4 different quadrants of the room, such that you will be in a group during lab with students everyone in your group will have taken home a different device and become an expert. So it'll be your responsibility as we go around the circle to teach the other students how to use your device. We'll just be teaching them pharmacist to pharmacist, and then we'll be calling on folks who would like to practice their counseling within their small group. Also during this lab, you'll see down here, we're going to have an instructor-led discussion and demonstration on the different nebulizers and spacers that are available on the market, and then we'll have a wrap-up at the end of lab. So I want to go over the device assignments are listed on Canvas, so you can see that document, pull that up to see which device your team will be working on. But then the homework questionnaire that's listed here, I want to point out page 1 is for the teams that are assigned one of the drug delivery inhalers. So you have 5 questions here, and it says here, teams who received the peak flow meter as their assigned device should skip to the next page. So if you, for any one individual team, you'll only be filling out page 1 or page 2. So if you have a drug, you're on page 1. If you have a peak flow, you're on page 2. That's your homework for this upcoming lab. And finally, let's take a look at this PowerPoint document that I said I don't want you to be afraid of. I'm going to move this so that you can see it a little bit better. So essentially, if you look online, you'll see this entire thing posted. Sorry, I'm doing a bad job here. But what you'll see here is these first approximately 8 slides talk about the importance of aerosol drug delivery. This is just a refresher in case you forgot any of this information from your pharmaceutics days. One of the most important things is that there are some advantages to administering drugs via the lung. And one of the important things is this concept of the respirable fraction. So the optimal particle size that we're trying to hit that deposits really well down in the lungs is 0.5 to 5 microns. If it's smaller than this, it just gets inhaled and then exhaled back out. It doesn't actually settle in by gravity into the lungs. And those larger particles just impact on the back of the oral pharynx and are swallowed into the GI tract. So in order to get good systemic effect of your drugs, you want to hit that respirable fraction. I will say that these next slides, all the way down to approximately slide 41, the next slides just go through device by device and give you a primer on how those devices are used and the instructions for patients. So you'll see device by device as you go down through, ellipta, Spiriva, everything's in here, peak flow meter. You can use this document to help you with your homework, the PowerPoint to help you with your homework, or you can just go directly online to look at the manufacturer's websites and videos to determine how to use these products and how to teach patients. I will say slides 41 through 45 are also unique information. It's going to be a good refresher to get you ready for that nebulizer section of lab where we're going to talk about different nebulizer therapies. So that's what you need to do to prepare for lab. If you have any questions, please feel free to send me an email. I'll be happy to respond. Thanks. Look forward to seeing you in lab.